In this video, we're going to be discussing about some of the most frequently asked questions about PCOD that pop up on my Instagram handle, which is @DrBabyMaker. So if you're not following me there, please go ahead and do that right now. But before we get started, make sure you also subscribe to my YouTube channel and also click the bell icon so you don't miss any of my future videos. So, question number one, what is PCOD and what might cause it? PCOD is a condition that affects about 20% of women in the reproductive age group worldwide. It is caused by hormonal imbalances, particularly excess production of androgen, which is the male hormone, and this can interfere with both the growth and release of the eggs from one or both the ovaries. The other factors that contribute to PCOD include genetics, insulin resistance, and inflammatory factors. Question 2, what are the common symptoms of PCOD and how is it diagnosed? The common symptoms of PCOD include irregular periods, weight gain, excessive hair growth, and acne. It is important to note that not all women with PCOD will experience all of these symptoms, and some of them might not experience anything at all. To diagnose PCOD, a healthcare professional will perform an ultrasound, a blood test, and a physical examination. Question number 3, how is PCOD treated? The treatment of PCOD depends on the individual's symptoms, her health status, and her fertility status. Lifestyle changes such as healthy diet, regular exercise, and weight loss will help manage PCOD symptoms. Medications such as hormonal contraceptive pills, metformin, and other drugs may be prescribed to regulate the menstrual cycle, control insulin resistance, and reduce androgen levels. In some cases, surgery like the PCOD drilling may be recommended to remove the cyst to improve her fertility status. Question number 4, can PCOD be cured completely? There is currently no cure for PCOD, but its symptoms can be managed effectively with appropriate diet and lifestyle changes, which I already mentioned to you before. A lot of research shows that weight loss and exercise can improve menstrual regularities, decrease on the androgen levels, and also improve insulin sensitivity in women who are suffering from PCOD. Question number 5. What are the fertility options that are available for women with PCOD? PCOD can lead to infertility due to irregular or absent ovulation. Medications such as clomiphene and letrozole can be used to stimulate or induce ovulation. Laparoscopic ovarian drilling or intrauterine insemination or in vitro fertilization will be recommended for women who do not respond to medications. Question number 6. What are the lifestyle changes that can help manage PCOD? I think by now you know the lifestyle changes are very crucial for PCOD. In fact, a healthy diet including plenty of fruits and vegetables and whole grains while also limiting the sugars and refined carbohydrates can improve insulin resistance and also irregular periods. Regular exercise such as brisk walking, yoga can also help manage some of its symptoms. Question number 7. Are there any natural remedies for PCOD that can be tried at home? While there are no natural remedies that can cure PCOD, some research also suggests that certain herbs and supplements may help manage the symptoms. But however, before you start anything, make sure you talk to your healthcare professionals because they would need to know if the herbs you take might have some interaction with the medicines they are prescribing. Question number 9. Does PCOD increase the risk of developing other health conditions? Yes, unfortunately, research shows that women with PCOD have a higher risk of developing type 2 diabetes, hypertension, dyslipidemia, cardiovascular diseases, in addition to other problems as well. Apart from that, women with PCOD are also more likely to have metabolic syndrome, which is a cluster of conditions that increase the risk of heart disease and stroke. Question 10. Can PCOD affect mental health? Actually, yes. PCOD can affect mental health as well. Women with PCOD are more likely to experience anxiety and depression compared to women without this condition. This might be because of the hormonal imbalances and the physical symptoms which are associated with this condition. How does PCOD affect pregnancy? PCOD has been associated with certain complications in pregnancy like gestational diabetes, pregnancy-induced hypertension, and preterm births. In fact, women with PCOD are also at a higher risk of miscarriage. Can PCOD increase the risk of endometrial cancer? Unfortunately, yes. Women with PCOD have a higher risk of developing endometrial hyperplasia, a condition in which the lining of the uterus becomes much more thicker than normal. If left untreated, the endometrial hyperplasia can progress to endometrial cancer. This is the reason why patients with PCOD should get a regular checkup with their healthcare professionals at least in every 6 months if they have irregular periods. Question 13. Is there a link between PCOD and obesity? I think this is a given. There is a strong link between PCOD and obesity. In fact, research shows that up to 80% of women with PCOD are overweight or obese. What is the economic burden of PCOD in India? PCOD has a significant economic burden. A study published in the Indian Journal of Endocrinology and Metabolism estimated that annual cost of PCOD management in India is about 27,000 crores, which is approximately about $3.5 billion. This includes direct medical costs such as consultations, medications, diagnostic tests, and as well as indirect costs such as loss of productivity and also absenteeism from work. What is the importance of early diagnosis and management of PCOD? Early diagnosis and management of PCOD is crucial to prevent complications and improve the quality of life. I think we all know this. Research also shows that women with PCOD who receive early interventions have a lower risk of developing type 2 diabetes and also cardiovascular diseases. In addition, lifestyle changes and appropriate treatment can help manage symptoms and improve their fertility outcomes as well. Certain studies have shown that first degree relatives of women with PCOD have a higher risk of developing this condition themselves. For example, a study that was published in Journal of Clinical Endocrinology has found that sisters of women with PCOD has a 30% chance of also having the condition. Another study which was published in the Journal of Fertility and Sterility found that daughters of women with PCOD were more likely to have irregular menstrual cycles, which is actually a common symptom of this condition. While there seems to be a genetic component of PCOD, the exact genetic factors that are involved are not fully understood. Several genes have been identified as potential contributors to this condition, including genes involved in insulin signaling and hormone metabolism. So it's very difficult to find out the exact genetic causes that causes PCOD. In conclusion, PCOD is a common hormonal disorder that can have a range of physical and mental health issues. So early diagnosis and management, including lifestyle changes and appropriate treatments, are very crucial to prevent complications and improve the health for the women who are suffering from PCOD. So if you like this video, go ahead, give us a like, share this with your friends and colleagues, and also subscribe to this channel for more such informative videos.